The myths and realities of prostate cancer next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by Atlantic Health, New Jersey Carpenters Funds, union contractors and union carpenters working to improve the quality of life for all New Jersey citizens. MD Advantage Insurance Company of New Jersey. Our knowledge is your best protection. And by Roche.
Welcome to a very special edition of Caucus, New Jersey. I'm Steve Adubato. You know, next to skin cancer, prostate cancer is the most common cancer found in men. But who is most at risk, and how can this disease be prevented and treated? Joining us are Dr. Joshua Fisk, urologist and chair of the Urology Tumor Board at Overlook Hospital; Anne-Marie Hill, executive director of the New Jersey Commission on Cancer Research; Virgil Simons, a prostate cancer survivor, has been with us many times as the president of the Prostate Net, an organization providing support and information for patients and their caregivers; and Gerald Muller was diagnosed with prostate cancer 2 years ago following a routine PSA test. I want to thank all of you for joining us. You've been with us before, Anne-Marie, Virgil, many times. I will tell you that I got my PSA test done after one of the last times you were with us, and we have more work to do, which is why throughout this program you'll see important information up on the screen, particularly our website, which will be linked to every organization here, every individual here, particularly the not-for-profits, because that's why we're here. Doctor, let me ask you, how prevalent is prostate cancer, and what is the biggest myth about it?
Well, prostate cancer is very, very common. If you were to take an autopsy of 80-year-old men, about 50% or more would have prostate cancer, so it's very, very common. The biggest myth is that you can avoid it and don't worry about it, because it's going to end up, at some point in your life, you'll be dealing with either with yourself, your family, or your friends.
Okay, another myth. Let's go right at it. Anne-Marie?
Another myth is that the exam for prostate cancer is terrible. It's actually life-saving, and men have to shore up and be brave and go and have those tests.
Well, why don't we deal with this? Because Virgil, who is taking our friendship as far as he can take it, said right before we went on the air, I mean, I was very proud to tell you I did the PSA test, and you said, Steve, there's more to do.
Absolutely.
Go ahead. What did you challenge me to do?
Have a digital rectal exam on air, because I think the whole thing is we need to show.
Back up. I'm sorry. My hearing piece is giving me trouble. Did you just say a digital rectal exam? And the last part, it must have been screwed up. You said on air.
On air.
Because?
Because I want people to see that you can man up and they can man up and be able to do this thing and be able to save their lives, because it's not that big a deal.
Why can't we just talk about it? I'm only kidding. But
yeah, right.
It is. And by the way, Katie Couric, when she stepped up and did what she did, I mean, it doesn't matter, and I'm not putting myself in I like her contract, but I'm not putting myself in Katie's category, Matt Lauer, or anyone on the national scene who's a celebrity in the media world, or you could be an actor, doesn't matter, or an athlete. But why is it so important that people who have a public profile actually do this? Why?
Because people still will emulate what quote-unquote celebrities do. If an athlete or a music star or someone in the public domain is able to say something, do something, people who are not will be able to believe that, okay, it must be all right, it must be good. There's a credibility factor that even the smallest of celebrities, not you're not in that category, but you know, will have a factor in terms of being able to help people influence their decision making.
Let's clarify the test issue here, because there are a couple different tests we're talking about, and I want to make sure when you log on to our website you'll get that information. What exactly is the PSA? What is it?
So PSA is a blood test that's done to look for a special protein that's made by all prostates. However, if you have prostate cancer, the chances are your PSA will be higher than someone who does not have prostate cancer. So we're looking for an elevated PSA, and if you have an elevated PSA, that puts you at a higher risk of having prostate cancer. It doesn't necessarily mean that you do have it.
Okay, so Emery said it's life-saving. Now, you actually took the test 2 years ago?
Well, I've gotten blood work done every year to check out different things about my body, and one of them was the PSA, which I've been getting since I'm in my early 50s.
So you've been doing it consistently?
Consistently every year, extended blood work.
So what happened a couple of years ago?
My PSA was in a range usually between 3 and 3.5, and in 12 months it jumped to 6.5. And my regular general practitioner, Dr. Barry, recommended I go to Dr. Fisk.
Okay, so what happens there? You get diagnosed.
I got diagnosed that my PSA was up. Then I had to go for biopsies of the prostate gland, or whatever you call it. And Dr. Fisk obliged me, and we went through it.
Was it life-saving in your mind?
I feel it was. Mine was very slight. My prostate had cancer in 1/12 of the mass of the prostate, which wasn't very bad. I remember Dr. Fisk saying we got good news and bad news, and he even had a little smile on his face. The bad news is you have prostate cancer. The good news is it's very slight.
So we got other public people, Joe Torre, you got Rudy Giuliani, you have Bob Dole, and the fact that all of them have been pretty public about this, right, has been a good thing, Doctor?
Yes. I mean, at least patients are more educated than they've ever been about prostate cancer and the options. Plus, they see the mayor of New York City being treated during his mayorship and getting back to work so quickly. Joe Torre was back managing in the same season. So it shows you that if you have an elevated PSA and you have the workup and treatment, you can bounce back into your normal routine of life relatively quickly.
But go back, in all seriousness, when Virgil brought up the digital rectal exam, where does that fit into this equation?
Well, if your PSA is elevated, as a screening measure, a combination of a PSA and a prostate exam, the combination of those two are the best ways to screen for prostate cancer. Sometimes the PSA can be normal, but you can feel an abnormality on the prostate on your examination.
Devil's advocate, aren't certain prostates or some people's prostates just enlarged?
Yes. Yes.
Okay, go ahead.
And there are some prostate cancers that will never actually become life-threatening. The problem we face, and this is a research issue still, is that we don't know what prostate cancers are going to progress and not, and those who will just stay as a minor problem for a man. And for that reason, certainly younger men, African-American men, both of who have a high risk, or not, younger men don't necessarily have a high risk, but men with a family history, these are individuals that you want to make sure you're at least having a conversation with your doctor.
But Emery, you in fact told our producers you felt the PSA is useful, but you believe we need to have an important public debate about it. What's the debate?
Well, there are studies that indicate that long term, and with the whole population, so I'll wear my public health hat for a minute, that prostate cancer may not change mortality, and that many men will actually die with prostate cancer rather than of prostate cancer. European studies have indicated that sometimes these interventions are not simply just going to be the answer. Having said that, in the United States, we're tending more and more to recognize that there are some questions left. We're trying to do research, but it means you really have to have an open conversation with your physician about this.
Okay, Virgil, you want to jump in here?
I do, because those studies that Anne-Marie talked about are spurious at best. I think we have the study done in the U.S., the PLCO study, which is
what?
PLCO.
Don't get too technical.
Prostate, lung, colorectal.
Go ahead. Let's not get too inside, too much jargon.
Basically, the whole thing is that they were looking to see whether the PSA test actually extended the life of men or controlled mortality. And they compared it to a study done in Europe on the same premise. In Europe, the study there showed a 20% survival advantage for men who had PSA tests. It did not show that same degree of survival advantage in the U.S., only because there was problem in terms of how this study was conducted. The issue I think we really have to look at is not just the test itself, but the emerging things of PSA velocity, which is more important than just the absolute number. Now,
velocity means?
Well, PSA velocity means how rapidly is your PSA rising. Don't look at a PSA fixed in one point, but look at it over the course of a 6-month, year, or 2-year period. So a PSA of 4 might seem like it's kind of borderline elevated, but if it stays 4 over 3 years, that's not as much of a concern as a PSA that went from, or even 1.5 to 2.5 to 3.5 might be more worrisome than a PSA that's stable.
That's the velocity issue.
That's the velocity issue.
But I want to be clear. I do not want to send out mixed signals here. Are we saying, doctor, that people watching who are, say someone's 51 years old, and he says, I want to get a PSA test. Any downside?
from my standpoint, if you're 51 and you're healthy, I feel very strongly you should have a PSA test and a prostate examination. The real debate is, are we overdiagnosing prostate cancer in older men that don't have that long of a life expectancy? Because prostate cancer tends to be a very slow-growing disease. So my answer to that is it's not as important to find prostate cancer in an 85-year-old male who's had a heart attack once before and diabetes.
47-year-old guy.
But that's exactly who you want to find it on, because if he has prostate cancer, then that will be a major impact on his life 5, 10, 15
We
years down
agree
the road.
across the board here?
I have to just be balanced. Some of those 47-year-old men may not have progressive disease, and we do not know enough yet.
Well,
We have to understand
I can't
that, though.
figure out who that 47-year-old
Amber,
is.
here's
one
the problem. Here's the problem. When you do this kind of program and someone is watching and they're looking for clear information that they can trust, they don't know right now whether they should go get tested. And I want to make sure that you are saying that there's no downside in getting tested.
Okay, I won't say anything.
All right.
No, you have to say, listen, I'm not telling you to say what you...
I think the problem that you're having is the problem that I'm having. It's not an issue of overdiagnosis. It's an issue of overtreatment.
Right.
And I think the case is that it is important, if not imperative, that men establish a baseline PSA level from which we can then make appropriate
What does that
medical-
mean, layperson's language?
You have a PSA test and you find out what your number is.
Baseline.
At a relatively young age,
Right.
Got it.
40.
Right. I mean, right now, the AUA is saying that men at 40 should
Got it.
have it.
Okay.
I've got mine. Now what?
Then
So
what-
I go back and I get tested next year or the year after. So my PSA when I was, say, 42 gets compared to where it is now.
Correct.
My 42-year-old PSA is my baseline. Right?
Right.
That's helpful.
Yes.
No downside here.
Now you have to go on a regular basis, and you have to have a conversation with your physician
Got it.
who has to really give you the facts, and you have to make an informed decision.
I'll tell you the one downside is that sometimes if your PSA is borderline and you have a biopsy and you have a complication, a rare but can be a complication of that biopsy, was it worth having the biopsy if your biopsy is negative?
How
Meaning,
rare is this?
It's rare, 1 to 2%, but if we do hundreds of biopsies a year, which we do, there's going to be several patients that have a minor complication. It might not be worth doing. Now, I don't necessarily, I'm just giving you the other side. I totally believe 50-year-old men with an elevated PSA should be biopsied.
Okay, Bill Berlin, Bill, you want me to say that? Oh, no, but some of our people, several people on our team who are between 40 and, say, 55, okay? And we've had this discussion. The guys have had, the women are not involved in this discussion. We'll talk about women's role in a minute.
Women should be, though.
Well, we will. But virtually all the guys here talk about this because we start these conversations a while ago. Virtually everyone on our staff, behind the camera, in front of the camera, producers, whatever, camera people, virtually everyone's done it. And we have found out valuable information, and we consult our physicians. Jerry, let me come to you here. Treatment options. Did you have several treatment options once you were diagnosed?
Yes. Dr. Fiss explained to me that usually if you're in your 50s, they would advise you to take it out. If you're in your 70s, to get seeds. I was in my 60s, and I had to make a decision.
Explain some of this stuff. No, I don't believe people know what seeds are. Because I believe Rudy Giuliani was treated with quote-unquote seeds.
Correct.
What does that mean, Doctor?
So seeds is the implantation of small little tic tacs that emit some local radiation to
You
the
don't mean
prostate.
Tic Tacs.
Like the small little
They look like.
radioactive seeds, but I'm giving you an idea that they look like tic tacs.
They are not Tic Tacs.
They are not Tic Tacs.
Because I'm thinking of the Seinfeld episode when they're doing the operation. The junior mint. So you know the scene. Edit that out. Okay, go ahead.
So, small radioactive seeds that emit local radiation to the prostate. The prostate is very sensitive to radiation.
Got it.
So that's an option for patients.
So the seeds, one. Any other options here?
Well, to take it out, to take my prostate out. That was the only option that I felt would be successful.
That worked for you.
Right.
Now, again, going back to it, you have to speak to your doctor, Virgil, right? You have to go through the options. You have to go talk about what the impact will be on your life.
Right.
Okay.
Because in whatever treatment you ultimately decide, there will be an impact of some type or another.
No matter what you choose.
No matter what you choose.
Right.
There's going to be an impact.
And the alternative of leaving it alone as a plan.
You can do that.
But again, you can...
In certain
right.
cases.
It's possible to do that.
But what you're talking about is what I did and what happened to me. I had blood tests since in my early 50s. and everything was fine. And all of a sudden, within a 12-month period, as I said before, it jumped up from 3.5 to 4 to 6.5. And I felt something was wrong. And I felt, you know, I felt
he made an informed decision.
But I felt it was going to be cancer, even talking to Dr. Barry. I just felt, and I knew it was going to be.
You felt that?
Oh, definitely. Why would it jump up that way?
Okay, but you had to go through the process of finding out. By the way, if you're just joining us, we're talking about prostate cancer. We're talking about how to, listen, speaking of prevention, preventable?
Yes.
Sure.
Talk about some of the things we can do specifically to prevent it.
We think you can eat healthy, meaning low-fat foods. There's some evidence that soy or lycopene products might be helpful in prostate cancer prevention, even though studies haven't been great. And being besides that, you have to just be on guard, especially when you're young. Get yourself tested and find it if it happens early. There's also some potential medicine that may or may not help prevent prostate cancer. One of the real big studies out that was done and was recently reported in the New England Journal of Medicine is whether or not Proscar, finasteride, which is a very, very common medication to help shrink the prostate, may help prevent the risk of prostate cancer, but it may also cause, if you do get prostate cancer, maybe a slightly more aggressive type. So all this data out there is a little bit confusing to interpret and to understand as a doctor and as a patient.
Virgil?
Well, again, the whole thing in terms of the high-grade tumor, that's been somewhat eliminated now in the recent studies where they've shown that the 5-alpha reductase inhibitors, which is the class of drugs that he's talking about.
Okay.
It's a general class of drugs like statins for heart disease. And what they've shown is that this class of drugs will shrink the tumor, and in shrinking it, you're able then to find more cancer as a percent of volume, which, as some people have thought of saying, well, maybe it's causing it to be a more aggressive and more higher grade tumor or higher grade cancer. So the reality is that in many men, it's found to be an effective preventive. And that we're seeing studies now that show that men in their late 40s can start taking this drug as a preventive and have very good preventive capabilities for the disease.
Log on to our website. This is part of our Informed Choices series. We talked about making, Jerry, the most informed choice possible about this and a whole range of other medical and clinical and health-related issues. Log on to our website. We'll link to the other organizations here and provide the most helpful information possible. A couple other things I want to put out there. Stem cell research as it relates to this whole question of prostate cancer. Talk to us about it. Where are we?
Actually,
and where aren't we?
We're at a very early stage, and in cancer, stem cell research is interesting because we're often looking for progenitor cells, which are stem cells, and we're looking because when they become cancerous, they're actually our more aggressive disease. So we're not looking at it totally as a curative situation, but to learn what's happening to make diseases more aggressive. In prostate cancer, actually, and we're very proud at the Commission on Cancer Research, one of the earliest researchers who we funded just made a discovery of a stem cell in prostate cancer. It's an adult stem cell. It's something adults have, and it looks like it might have a role in causing prostate cancer. You find a cell like that, and then molecularly, we're starting to become to target those cells. So I'm extremely hopeful about this type of research, and I think the potential's ahead of us, and maybe we won't have to struggle so much with not having as many answers as we need.
And by the way, Virgil, why is it, as Amory's talking about this this work in the area of stem cell research, why, I ask you this every time you're with us, and I still am not clear, why is it that African American men have a higher propensity, if you will, to get prostate cancer? Why?
There's a couple of issues out there.
Is there a short answer?
No.
Go ahead.
No. If I wish there were, but there really isn't. I mean, they've just now discovered on the human genome, or the map of the human cellular structure, a certain gene track, it's called 8q24, that has been the most causative factor in terms of genetic prostate cancer among African American men. They've found that, they've identified it. The problem is we don't know what turns that switch on or off.
So what do we do about it? What's your advice to African American men?
I think the thing is that we have to, where possible, be part of the research process. We need to be able to participate in those studies that are going to help us have more information about
Do enough
those
African American men participate in those clinical trials?
No. No.
Is there a reason for that?
Fear. I think there's a lot of fear in terms of going back to the days of Tuskegee and to the small
Clarify
park.
that for folks. There were some experiments that are pretty historic and significant in our country.
Right, back in the from the late 20s, early 30s, early 40s, there was a series of studies done out of Tuskegee Institute in Alabama, where they were looking to see the progressive role of syphilis among African American men. And what they did is that basically they took this cadre of men, introduced the disease, or if they didn't have it, let it progress, and they did nothing. They didn't treat the men.
And you're saying that the remnants of that, the memory of that for some, the history of that for some, causes them not to want to be involved in clinical trials. That's a mistake.
That is a definite mistake.
Doctor, talk to us. What else in terms of clinical trials?
Well, I feel like some of the clinical trials are either going to help us find it earlier. So, for example, if we could identify the gene, then we could screen patients for it and not biopsy everyone, just find the patients that are at the highest risk. They've already doing that for breast cancer, and it's been somewhat more successful that if they can localize a specific gene in patients and do a blood test to find it, boy, would it be good to know that you're at the highest risk of having prostate cancer versus the lowest, and whether or not you need to be someone that's very vigilant or not as vigilant about your prostate cancer. And that's a target therapy. That would be great as well.
I'm looking for signs here because I remember one of the things for me is I was like, geez, if you're having problems urinating or pressure or there's pain urinating, oh, that must mean, no.
Not necessarily.
See, prostate cancer is generally a silent disease.
Silent.
By the time it causes symptoms, it is usually a much bigger problem than you want to get into.
That's why you go for the test.
Exactly. We want to find prostate cancer before it causes those signs and symptoms. Now, you could have urinary symptoms. That's more commonly a sign of benign prostate growth, which most men have as they get older. Prostate cancer is usually a microscopic disease without any symptoms until it gets to a point where it's grown or spread.
Jerry, I want to talk about family support because your organization offers a lot of support. It's very important. And again, log on to our site. We'll hook you up with Virgil Lloyd's organization, which does really important work. It is called the Prostate Net. But let me ask you something. Jerry, family support an important issue for you?
I don't know. I don't really feel I needed it. I just feel I'm very practical. I'm very honest.
What do you mean? This is your thing? You'll deal with it?
Yeah, I mean, I did inform my wife and my son.
Well,
but
that's a nice thing.
Come
on, Jerry. What do you mean you informed them? Weren't they in on the whole thing?
Not really, because I felt even today with any health issues I have, I just go and take care of them. And
sorry, go ahead.
And I had some good doctors. Dr. Barry was good. Dr. Fisk was good. And I got other doctors as far as I'm diabetic. And I just listen to them, and I study as much as I can, and I just go forward.
We're glad for you, Jerry, but I'm wondering for all those out there, big babies like myself, who say, I need some help. Go ahead, jump in.
So Jerry's a little different because
he's tougher than I know. He's like tougher than I am.
He's like Superman.
By the way, Jerry, thank you for making me feel like a big baby.
I'll tell you that most of my patients do have a support group with them, either friends that have had it or more commonly their spouse or children.
Right.
When I come in, after I do a prostate biopsy, I usually tell my patients, when you come in for the results, please bring someone. And then if they have prostate cancer, I usually talk to them and I tell them to come back in a week or two, definitely with someone, or I encourage that. I think that you remember more, you feel like it's nice to have a hand to hold, and your questions get answered, and there's always spouse questions or family member questions. You don't have patients feel like they didn't ask all the right questions. I tell them to please write things down, bring in the pad, and we'll sit, we'll talk. I usually do that conference like at the end of the day or the beginning, so there's no one rushing me. And that's the prostate, we call it prostate cancer conference in our office, and we do them, and we know that this is an amount of time that where the questions could be limitless, and we make the right amount of time, and I really encourage them to bring a family member.
Are there any support groups out there? Go ahead.
There's a lot of support groups, and I have to, I mean, Jerry is somewhat unusual in that he didn't feel the need, but I find that prostate cancer creates more anxiety than any other cancer that I have to work with, because there aren't black and white answers. There are a lot of unknowns, and there are a lot of side effects. If you go one direction, there are these side effects if you go another direction.
What are some of the side effects?
Well, if you have a prostatectomy, if your prostate's removed, you may have incontinence and impotence. And boy, mention those two things to guys, and they go, ah!
Why do you think that is?
Because
I'm
you're
joking.
guys. No.
Virgil, serious stuff, though, right?
Well, the reality is...
Got a minute left. Go ahead. Final comments. Go.
The whole thing is that the word cancer causes your brain to go on reject. And at that point, you don't hear anything else past cancer. And you need to have someone to be there to help answer the questions you can't ask, to be able to hear the answers that you can't hear, and to be able to give you the support you need to get through this.
So sometimes even if you don't think you need.
Oh, yeah.
You do.
You do.
And then the support group, you're big on the idea of support groups even after
Absolutely.
you're getting treated the whole bit?
Absolutely, because again, there are things that a support group and people who've been down the road can tell you that oftentimes the doctor doesn't have time to tell you, or it just doesn't occur to him to tell you.
Final comments, 30 seconds, go.
I think that you need support throughout the whole survivorship of your prostate cancer, and you need to find those resources, and we'll make them available on your...
Jerry, what's your advice to guys out there?
Confidence in your doctor. That's my support group.
Doctor? He put it on you.
That's what we say.
10 seconds, go.
Stay educated and ask the questions that you feel are most important.
I can't thank you enough for doing a great public service. Great job.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org and visit us online at caucusnj.org. The preceding program has been a production of the Caucus Educational Corporation, celebrating over 20 years of broadcast excellence, NJN Public Television, and 13 in association with WNET.org. Funding for this edition of Caucus New Jersey has been provided by Atlantic Health, New Jersey Carpenters Funds, union contractors and union carpenters working to improve the quality of life for all New Jersey citizens. MD Advantage Insurance Company of New Jersey. Our knowledge is your best protection. And by Roche. Promotional support provided by NJ Biz. All business, all New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.